Welcome to this update in HPV-related head and neck cancers from Johns Hopkins Medicine. I'm Elizabeth Tracy.
I'm Carol Fackery. I'm a head and neck surgeon.
I'm Tony Zivert. I'm a medical oncologist specializing in head and neck cancer.
I'm Anna Keese. I'm a radiation oncologist.
Thank you so much for joining me on this production. It's so wonderful to have all of you here because, of course, head and neck cancers are really complicated and they require all of your specialties. I'd like to start first just by kind of framing up the issue. How often do head and neck cancers occur?
So in the United States, there are about 40,000 cases of head and neck cancer. The predominant growing type now is HPV positive head and neck cancers. There are about 15,000 cases of HPV-related head and neck cancers a year in the United States.
And since that's what we're talking about, isn't it true that HPV-related cancers have a better prognosis than those that are negative?
Yeah, indeed. These HPV-associated head and neck cancers are increasingly becoming more common. There's literally, quote unquote, an epidemic of these tumors. And what is striking is that they have a significantly better prognosis. They do much better. We cure them more frequently. They do better with surgery, with chemotherapy, with radiation. So yeah, it's a different problem. It's more common, and there's a difference in prognosis.
How are we accounting for the fact that this transition is taking place?
We do HPV testing. We actually try to identify which patients are HPV positive and which patients are not HPV associated. And we're starting to think about treating them differently, although right now we apply the same treatment approaches, but I think we'll talk about ways here at Johns Hopkins how we're trying to move the field forward and actually really take account of this difference in the biology.
I guess what I'm interested in is why previously did we see relatively fewer cases that were HPV positive, but now we're seeing relatively more?
So before, the primary type of head and neck tumor was tobacco and alcohol related. And with a successful public health campaign for tobacco cessation, we've seen a decline in tobacco related cancers and head and neck cancers. And we've seen a rise in HPV related head and neck cancers. And we think that that's attributed to the sexual revolution and increased exposure to oral HPV infection, which is a sexually transmitted infection.